in 3, 2, 1, go!
Home remedies you should know for a UTI. There is nothing that can throw your mood off course faster than a UTI. A UTI can seemingly strike out of nowhere, ruining weddings, vacations, and countless other events. They're uncomfortable and inconvenient. Also known as a urinary tract infection, a UTI occurs mainly in women but will affect 1 in every 10 men in their lifetime. UTIs are commonly caused by fecal matter that travels from the anus through the urethra, which is the main reason why doctors tell women to wipe front to back rather than back to front. Because bacteria can also enter the urethra following sexual intercourse, it's also highly recommended to pee afterward, via WebMD. Symptoms of a UTI most commonly appear in the form of a burning feeling when you urinate, a need to urinate much more often than usual throughout the day, and pain or pressure in your lower back. If you begin to experience fever and chills, this can be a sign that the infection has spread to your kidneys, in which case you should seek immediate medical attention. If your infection is minor, it's still best to consult with a doctor, but if you can't quite get to your physician in time or it's not bad enough to require antibiotics, there are some steps you can take at home to treat the symptoms and get the infection out of your system quicker. The main home remedy for a UTI is simple. According to Medical News Today, 25–42% of UTIs are able to clear up on their own. As with almost any minor illness, one of the best things you can do when you have a urinary tract infection is to make sure that you're drinking tons of water. Water acts as a filter that helps your urinary organs flush out bacteria. It also allows urine to pass through more quickly and become more diluted, which keeps it from infecting the cells lining the urinary organs. You will also want to avoid holding your urine for any period of time to reduce the amount of time that bacteria have to take hold. You've likely also heard that cranberry juice can help prevent UTIs. While it's true that the juice contains a tannin that is believed to prevent E. coli bacteria from causing an infection, this has not yet been proven, via WebMD. Instead of chugging bottle after bottle of ocean spray, head to your local drugstore and pick up some Esso. According to the brand's website, such products slow down the growth of the infection and control the frequency of urination and the burning sensation that occurs. A trip to the doctor is always a good idea if you are coming down with a UTI, but in the meantime, you may want to try some of these tricks to clear the infection on your own. How to tell if you have cystitis or a UTI. If you have pain when you urinate, or bladder or kidney pain anytime, it's often a cause for concern, via Mayo Clinic. While a bladder infection is painful and annoying, you could end up with more severe problems if the infection spreads to your kidneys. Single Care reported that you get a urinary tract infection, UTI, if microorganisms from your body end up in your urinary system. Most commonly, Escherichia coli, E. coli, ends up causing the condition in the urethra, ureters, bladder, or kidneys. Occasionally, other bacteria cause the infection. If the infection travels to your kidneys, you have a rare risk of kidney disease or sepsis, which can be life-threatening. However, if you feel bladder pain, it's not always due to a UTI. Instead, it might be something called cystitis, according to Single Care. These two problems have some similar symptoms, but the treatment might be different. Listen on to find out how to tell the difference between cystitis and a UTI. Here are the symptoms of cystitis. According to Single Care, cystitis is inflammation of the bladder. Cystitis can be either acute, it could happen suddenly, or interstitial, which means it could be a long-lasting situation. Mayo Clinic reports that symptoms of cystitis include a strong, persistent urge to urinate, burning sensation when urinating, passing frequent, small amounts of urine, blood in the urine, hematuria, passing cloudy or strong-smelling urine, pelvic discomfort, a feeling of pressure in the lower abdomen, and a low-grade fever. Additionally, young children might experience new episodes of wetting. Some of these symptoms overlap with those of a UTI, and pain in the lower back or sides, kidney, fever/chills, incontinence, and vomiting are additional signs that do not overlap with cystitis symptoms. Single Care reported that bacteria, sexually transmitted infections, or trichomonas, a type of parasite, could cause a UTI. However, cystitis has various possible causes, including bacteria, chemicals from feminine hygiene products, kidney stones, diabetes, radiation, chemotherapy, and medication, use of a urinary catheter, blockage of the urethra or bladder, or pregnancy. Therefore, the diagnosis and treatment for cystitis are somewhat different than those used for UTIs, even though there's plenty of overlap. Here's how doctors treat cystitis. To diagnose cystitis, your doctor will do a urinalysis to examine your urine for bacteria, via Single Care. A cystoscopy, which involves a long tube with a camera that looks at your urinary tract, or imaging might also help the doctor make the diagnosis of cystitis. The diagnostic process for a UTI may be similar, but it also includes a urine culture. If you have unresolved cystitis, be sure you drink plenty of water, avoid caffeine, and don't hold your urine. If it persists, you should contact your doctor for more advice. Often medications like ibuprofen, acetaminophen, and a wide variety of antibiotics treat cystitis that doesn't resolve at home. Doctors often use similar measures to treat a UTI, but there are additional antibiotics they might try. According to Mayo Clinic, if your symptoms return after a course of antibiotics, be sure to let your doctor know, because you may need treatment with a different medication. Here's the big difference between a UTI and a yeast infection. Whether it's after sex, a day at the beach, or just a regular Friday, having any discomfort and itching, there, can ruin anyone's day. Every woman knows there's nothing more uncomfortable and painful than having burning or itching sensations down below. Whenever we get that slight burning feeling, we immediately wonder what's going on south of the border. Many women are quick to assume and self-diagnose by looking online and reading some symptoms that match theirs. Most of the time, burning and itching can mean that you have either a UTI or a yeast infection. The biggest problem that many women go through is trying to decipher which one they have. While both infections are incredibly uncomfortable and annoying to deal with, they both have vastly different treatment options. Therefore, knowing which one you have is imperative to treating it and making sure it goes away and doesn't come back. So, how do you tell the two apart? The reason many people struggle with identifying their infection is because UTIs and yeast infections have similar symptoms. Both infections have burning and itching, and both cause painful urination, via self. However, there are a few major differences between the two. UTIs happen because of a bacterial infection. This can be from wiping incorrectly, wearing clothing that lets in too much moisture such as spandex at the gym or a wet bathing suit, or from intercourse. Yeast infections are different because they are caused from an overgrowth of the Candida fungus. Ironically, yeast infections can stem from UTIs if you happen to be on antibiotics, as they are known to be correlated. UTIs tend to cause other symptoms associated with going to the bathroom, like frequent urination, even when you don't have to go, via Healthline. If a UTI gets too aggressive, you can also have a fever and severe lower back pain. On the contrary, yeast infections cause some foul-smelling odors from your vaginal area and also cause thick discharge that can be milky white. When you have a yeast infection, you also may have a swollen vulva along with your symptoms, via Medical News Today. The most important thing is that if you think you have either infection, you go to see a doctor immediately. A doctor will be able to diagnose your infection, put you on the right medications, and help you monitor your symptoms. And buy some cranberry juice, just to be safe. Things that happen to your body when you wait too long to pee. As newborns, infants, and toddlers, we eventually start to learn how to control our bladders. Our brain only knows that when we have to go, it's time to go, and for many of us, we'll need to go around 6 or 7 times a day. After some training we learn to control when we go, and how long we're able to wait before we get to a bathroom. And sometimes we wait a little too long. There may not be facilities nearby, or we're just too busy. But holding it in isn't necessarily a bad thing, until it becomes a habit. That's when problems begin to arise, some more severe than others. Your bladder can only take so much. Your bladder is only capable of holding so much, roughly 2 cups of water, 16 ounces, comfortably. For kids it's even less, only 4 ounces. Think of your bladder as a muscle because, well, that's exactly what it is. When your bladder is overworked, it can affect other things, for example, your pelvic floor. Your pelvic floor muscle is what controls whether or not you're going to keep urine in, or let it out. Imagine going back to your infant days. So, you want your bladder to be in great shape. Your brain won't know it's time to go. Believe it or not, the more you put off emptying your bladder, the more it stretches out. Dr. Kamandeep Bali, a naturopathic doctor at the Toronto Naturopathic Health Clinic, told the Huffington Post that once the bladder stretches, your brain can lose its ability to know when you have to go. That critical message your bladder sends to your brain when it's time to go, can go unnoticed. Which could potentially mean you could actually pee your pants. Now that would be embarrassing, and in my opinion, could possibly be a worst-case scenario. OB/GYN, Lauren Stryker MD told Redbook, as your bladder gets fuller and fuller, there's a good chance you aren't going to make it to the bathroom on time. Yikes. Many of us have been there, that just barely made it scenario, where the bathroom line may have been just slightly too long, after you sprinted to get there. It's more likely to happen to young children and the elderly, but that doesn't mean it can't happen to you if you push your bladder too far. Cue the adult diapers. You could get a UTI. About half of all women have had a urinary tract infection, UTI, at least once in their lives. These infections occur because bacteria has made its way into the urinary tract, which then causes symptoms like burning, the need to urinate frequently, and pelvic pain, among others. But UTIs aren't actually a direct result of holding in your pee. If you don't empty your bladder enough, your body becomes a breeding ground for bacteria, which can then cause a UTI. Bacteria can create other problems. UTIs aren't the only thing that can occur if bacteria makes itself at home in your urinary tract. Different adverse effects can include further infections, fever, pain, cramping, and more. It's definitely a domino effect. Save yourself the hassle and just go. Other organs can become damaged. Your bladder connects to your urinary system, which includes your kidneys. The kidneys create urine from the excess water in the bloodstream, and by filtering waste. The Kidney and Urology Foundation says that if urine travels back up the tubes that connect your bladder to your kidneys, it can cause infections and kidney damage. New York urologist Alex Steinchley-Uger, MD, also explained in an interview that in long-term cases of holding in your pee, elastic tissue can become damaged and eventually be replaced by scar tissue, which then can cause kidney damage down the road. Avoid alcohol and caffeine. Alcohol will cause you to use the bathroom more, and so will coffee and caffeinated drinks because they are diuretics, meaning they can increase urine production. So if you're worried about having to use the bathroom often, maybe you're on a road trip, or you're stuck in a meeting, don't drink them. Just go. The more holding it in becomes a habit, the more you're going to see the problems it can create. It's important to make sure you get to the toilet, not just because of the sheer embarrassment of a potential accident, but because of the fact that some of the health consequences can be very severe. Allow yourself ample time in your day to free your pee, and you'll be golden in more ways than one.